audience, we're really excited to be here with you today to discuss ACA compliance. Our agenda is going to consist of taking a quick look at the compliance landscape and the challenges associated with that, and then we're going to take a look at what are the better approaches that are available, including examining some success stories, and then if we have time, taking some questions. So with that, let's proceed here. Okay, let's dive into the challenge of ACA compliance. So broadly speaking, as a technology and services provider that's had the opportunity over close to the last decade to assist organizations in process engineering, compliance approaches, and having had the opportunity to be exposed to over 1,000 different companies in terms of the way that they manage ACA compliance. When we at Trusaic think about ACA compliance from across the business landscape, we think about two broad business employer segments, broadly speaking. And so segment one is a workforce, this may be you, that has variable hour, part-time or seasonal employees, more than it's a non-trivial amount, right? So, more than just a couple percentage points of your workforce consists of variable hour, part-time and seasonal employees. And if that's true for you, then you need to apply the look-back measurement method, ideally speaking, in order to manage hours of services tracking in a way that's optimal to the business. And for this segment, really, there's kind of two core big picture items that need to be true in terms of their compliance approach. One is that they have to have a robust monthly ACA tracking process in place. And the second is obviously the annual end of year reporting to the IRS. That includes fulfillment to employees of the 1095C schedules, as well as any state filing if applicable, if you have self-funded enrollees in California, Rhode Island, or New Jersey, or really just any employees in DC. And so, with respect to segment one, it's really critical to point out that monthly ACA tracking piece, because where many organizations get into trouble is they fail to treat the ACA compliance process as a monthly process. They wait till the end of the year, they get into trouble. Segment two consists of organizations that are predominantly full-time employees. And because, if this is you, because you have predominantly full-time employees, you don't need to apply the look-back measurement method. You could if you'd like to, but there's really no need to. And more of your pain points come around the end-of-year reporting piece, where you're having to report to the IRS, to states, and again, to provide accurate 1095C schedules to applicable to individuals, including employees and non-employee enrollees. So let's dive into these a little bit here. We're going to share a quick, think of this as a case study, a home health organization with right under 9,000 employees. This employer clearly fits into that employer segment number one. A lot of variable hour, part-time, and even seasonal employees in this vertical industry space. And so as a consequence, this employer, when they came to us, they were having issues, number one, because they were just failing to treat the ACA process as a monthly process. They were waiting till the end of the year. They were running into issues with data, inconsistencies not adding up, compliance issues that they weren't flagging. They had no idea what it was they were actually filing with the IRS. And so they had issues with both the lack of having a monthly ACA compliance process, as well as a lot of administrative friction and inaccuracy with respect to the end of year process. And so we're just going to call out and unpack a few of the issues that they had with the monthly process. What you see in the bullet points at the bottom of the page where it says common ACA friction points, under each one of these column header categories of data unification and transformation, data cleansing, and full-time calculation are basically a selection of common issues that we see segment one business employers struggle with. For this particular employer, Because of the nature of the manner in which they've been growing, which was inorganically, largely via acquisition, they had a lot of different non-consolidated systems. Data quality was a big issue. A lot of people were missing hire and termination dates, or it was spotty at best. They also had missing leave of absence data, and they had people working at different locations, different kind of switching back and forth between locations and EINs to make matters a little bit more complex. They had, in some cases, hours of service that just did not make sense, that had been created due to payroll adjustments. And they had failed to properly configure their measurement periods. And so they had to add to all of that, they also, their prior compliance process had no mechanism for providing them with ongoing lifetime visibility around their ACA penalty risk exposure. And so the first thing that we did when we implemented this customer and got them set up was ensure that as we established connectors to their data feeds, we configured data quality validation workflows on the Trusaic side to ensure that all of those data quality issues were being dealt with, particularly the hire and termination dates, making sure that we had a validation engine in place to be able to automatically calculate what those ACA employment periods were, and then properly configuring their measurement methodology to make sure that they were actually reviewing each month, as the IRS requires you to do, employees who were coming up as trending or pending full-time. And then with respect to the end of the year process, this customer really benefited from the ability to see before filing with the IRS what their current 1094C and 1095C code structure implied in terms of penalty risk assessment. And that, at the end of the year, allowed them to make final checks and tweaks and tunes and adjustments and refinements to the data that was being filed to the IRS. In addition, we were able to remove a lot of the administrative burden for them around the fairly intensive process of filing with the states. Although the data format is the same data format for California, Rhode Island, and New Jersey, an XML data format, it's a subset of the employees, and many employers, including this home health organization we supported, found that they didn't really have clarity on how to easily get that data subset that needed to be filed with those states. So we were able to help them and assist them there and avoid the two negative outcomes that you see on the right side, which are high administrative burden and inaccurate and out of compliance reporting, which can obviously lead to IRS penalties. So the next little case study that we're going to look at is a employer that falls into segment 2. So this organization is a financial services organization, a little under 25,000 employees, predominantly full-time, no need to apply the IRS look-back measurement method, and their pain points were really just around the end of the year process. So on an ongoing basis, they were offering health coverage to essentially all of their employees. Their data was fairly clean, fairly accurate, but what they had an issue with was they had received 226J letters from the IRS in the past. Although they knew that their policies and practices had them in compliance from a technical perspective, they realized that they didn't have appropriate, robust measures in place to ensure that what they were filing actually matched the compliance pattern and facts and circumstances that had transpired throughout the year. And so by easily configuring our penalty risk exposure visibility dashboards, we were able to point them to situations where there were individuals that were just erroneously missing codes in line 16, the safe harbor codes. We were also able to point them to situations where there were incorrectly listed monthly premiums in line 15. With this particular employer, in some cases, they were listing the premium cost of the plan that the individual had enrolled in, not the lowest cost plan that they had been offered. And so our simple data validation checks allowed them to quickly pinpoint and hone in on that. And as a consequence, they were able to fix affordability safe harbors that had originated from that incorrect line 15 monthly premium amount listing. In addition, they had most of their enrollees were enrolled on self-funded plans, and one of the big burdens that was able to be lifted was the Trusaic auto data consolidation process, which removed a lot of the administrative burden for them. In addition, for this organization, they also had state filing requirements because they were operating in California and New Jersey, and so the Trusaic seamless white glove approach to the state filing process was able to remove the administrative burden for the customer around the end of year process, as well as to completely eliminate any risk of IRS penalty exposure via the penalty exposure visibility dashboarding that was configured for them. So 2 great success stories. And what is the context within which we're operating right now, right? The reality is that the IRS continues to, and it is actually increasing their enforcement efforts. We all know as practitioners, been around, the ACA has been around for almost 10 years. The IRS does anticipate collecting close to $250 billion in penalties through 2026. And so we see their audit stringency and their audit sophistication increasing. And so the penalties can scale very quickly, right? Many folks don't realize, and many HR leaders don't realize that ACA noncompliance is one of the largest potential sources of financial liability exposure to HR departments and the business as a whole, stemming from kind of people and HR issues. And so you can see here that even a business with 500 employees, they face maximum 4980 ACA penalty amounts of right under $1.3 million, and that scales up very quickly. If you have 10,000 employees, the maximum potential amount is $25.7 million. Now we have the opportunity at Trusaic to actually have empirical data around what the true actual penalty risk exposure is for a variety of employers across the US business landscape. The reality is that the actual penalty risk exposure that any one employer has as a consequence of what they filed with IRS tends to be less than the theoretical maximum for their employer size, but it isn't trivial and it's often significant. And so we help employers through our partnership network as well as directly and measuring that risk. And so what you see in the bottom left quadrant of this screen here is the average risk assessment amount for selected employee size organizations. And so for 500 employees on average, although on the right side you see that the total potential theoretical maximum penalty exposure is $1.3 million, we see on average $122,000 of penalty risk exposure. So roughly 10% of that potential theoretical maximum, but still substantial, right? No one wants to get a penalty for $122,000. And the problem is that the IRS can send those letters at any time. They may arrive 2, 3, 4 years after the non-compliant filing took place. And that scales rapidly. So for employers with more than 5,000 employees, we see on average $3.6 million in penalty risk exposure and by analyzing the 1094C and 1095C schedules that were filed with the IRS. And again, that's not anywhere near the potential total theoretical maximum, which you see on the right side, which for an employer with 5,000 employees, $12.85 million, but still substantial, right? No one wants to receive a penalty letter for $3.6 million. Excuse me. And so when we do run these penalty risk assessments for employers, we find that 3/4 of them have some form of penalty risk exposure that in 99% of cases they had no idea was there. Okay, so let's talk a little bit about how we are actually able to achieve better results for organizations. And so what we have listed here is a sample data and process flow where on the left side, we know that everything starts with making offers of coverage to ACA full-time employees, and particularly for that segment 1 category, right, where there's a non-trivial segment of the workforce that consists of part-time, variable hour, seasonal employees. It's critical that on a monthly basis, those offers of coverage be made timely to those ACA full-timers that have been determined to be full-time as a function of being measured under the IRS look-back measurement method. Because remember, if we don't meet that 95% pass-fail threshold each month, that's where we're exposing ourselves to that 4980 HA penalty risk. And so what happens is when we get into a good rhythm here and we establish our process with our implementation team, the client data, the benefits data and documentation is flowing from SAP or the Ben admin system into the Trusaic ACA system. Payroll and benefits are getting consolidated. That's automatically creating an ACA compliant report. The client, whoever's managing the ACA at your business, receives automatic notification that that's being created once each month. You're able to log in, take a look at any of your monthly action items, make offers of coverage to folks that require it, and then that cycle repeats 12 times throughout the year. And this is really critical. And one thing that we find very helpful for organizations in segment one is to, for at least for the first several months, institute a monthly review meeting where we're dealing with any data issues where perhaps there's penalty risk exposure that's being flagged, not because an organization is necessarily actually out of compliance, but because of data issues that may exist, right? Where perhaps the benefits eligibility dates are wrong, and so that's causing employees to be listed as not having an offer of coverage when in reality they did. And so that needs to get cleared up and cleaned up, and it should be done well before the end of the year. And so we get into a rhythm where that monthly process happens once each month, 12 times through the year. And then when we get to the end of the year, it's a simple matter of generating the 1094C and 1095C schedules, which we're already confident in, finalizing those, and have very simple approval process, which at this point is pain-free because we've already done our review sessions during the months in a very structured, organized, and consistent manner, at which point we flow into the distribution process to applicable individuals, where the client can choose to distribute forms, or they can make use of Trusaic's ability to print and mail those schedules or to distribute them electronically. Electronic filing happens with the IRS, and Trusaic also generates a dynamically updated compliance risk management report in the event that there's ever any regulatory inquiries or audits by the IRS. That's already created, and Trusaic will handle any questions that may arise from the IRS, whether it's a 226J letter or similar, including inquiries from the Department of Health and Human Services or the CMS or the DOL that may arise around the ACA. So, obviously it's easy to make it all look simple on a data and process flow, but really the beauty of the delivery model is that when Trusaic institutes these data processes and these connections between the SAP systems and the Trusaic ACA platform, the process really does become simple because so much of the administrative burden of that monthly process of validation and ingestion and review is owned by the Trusaic technology and services teams. So with respect to that second segment, the folks that just haven't, the second segment is you have mostly full-time or predominantly or even maybe all full-time. Everyone for the most part is offered health coverage. You don't really have a need to do the monthly reviews and use the IRS look-back measurement method, but you do need a robust end-of-year process. And so what Trusaic does for this category of employers is we're able to take the XML files that are generated from SAP. We obtain that via a quick integration. That gets generated, COBRA reports get generated, and Trusaic receives that data, consolidates it, validates it, creates a compliance report that then is shared very easily. That data payload gets passed back to the customer to review. The client can choose to review it on their own, but oftentimes they choose to review that with an implementation services member. And that allows you to be able to identify those compliance issues before you file, right? That those pesky data or coding issues that are creating potential risk. You have full visibility on that. This is something that customers love because they can rest easy with assurance that they're not going to be receiving a penalty letter from the IRS in 2, 3, 4 years. Once that, there could be a couple iterations in that center section where there's a compliance report generated, and you as the customer are reviewing the results there of any flagged data inconsistencies or validation points. And once you and we feel really comfortable with that process, we move forward to file with the IRS and states if applicable, as well as to perform the fulfillment process to applicable individuals, either via print and mail or electronic distribution if preferred. Some customers also choose to make use of both and for different employee population segments. And then obviously Trusaic will handle corrections with the IRS and states if needed, and provides full audit support in the event that there's ever any questions from the IRS or any of the other regulatory agencies. So one of the themes that you've heard in our short session today is really around the need for, whether you're in segment 1 or in segment 2, to have visibility around what it is that's being filed with the IRS. And so this is a overview dashboard that provides just that. It's live time pulling from your data, from your payroll and benefits data, consolidating that live time to show what the IRS will see when you actually file, even at any point in time. And this is being tracked month over month throughout the year, so that you have plenty of time to make adjustments before filing. And again, I can't harp on that enough, how critical that is, that this be thought of as not just an end of the year check the box exercise, particularly for those segment 1 employers, because that's where they can really run into problems. And so by having the ability in one screen, very simply, to see what is my current 4980HA penalty risk, again, that A penalty risk, that 21,416 that you see on the screen here, that's coming from the failure to meet the 95% pass-fail offer coverage thresholds to ACA full-time employees. And so you can then quickly drill down on where that risk is coming from, which employees, and so you can see in the bottom right, which there's 47 employees that are triggering that 4980H risk. We can quickly drill down on those and make adjustments at the data level and or at the coding level to ensure that inaccurate compliance risk is not being filed with the IRS. This is a drill down of that overview screen, where for those who desire to just have a little, even more detail, even more granularity around the compliance tracking, you can see month by month the compliance percentage, whether that 4980HA pass-fail threshold was met. So you can see on the very right column that it was not met because the employer is at 94.9% offer coverage for that month. You can see the total number of employees that are triggering the exposure, as well as the exposure dollar amount for both A and B by month, and as well as the active employees and employees for each month. That to be incredibly valuable. Just one moment. My apologies. So as we wrap up here, what are the key points and themes that we hope that you take away from this session? Well, number one is that regardless of which segment you fall into, segment 1, where you do have part-time, variable, and seasonal employees that require this to be a monthly process, or you fall more into that second segment where you do consist of predominantly full-time employees, in either case, the process can be more efficient. We hear it all the time. Wow, we didn't understand that there was a delivery model available like what Trusaic offers. We're intrigued. We'd like to learn more. Frankly, a lot of times we hear it sounds too good to be true. I don't believe you, right? And so it's not until we get into actual demos and really unpack that delivery model that employers are, that haven't worked with us before, really start to understand that there is a very efficient, tailored set of solutions that Trusaic offers that can be deployed to dramatically reduce risk, drive data accuracy, make sure you're proactively compliant, and just overall reducing your friction and headaches around both the monthly and the annual end of your ACA filing process. So with that, we want to thank everyone for joining today. I know we're almost at time here. We really appreciate everyone attending the session, and we hope that it was of value to you. And we'd appreciate you reaching out if you have any questions.